So, Healthcare Quest, day 2. I figured I'd go ahead and just jump right on this one today and get this posted. We're here day 2, and I began with a phone call to one Mary Elizabeth Marr. Now, she's the CEO of the AIDS Action Coalition, which I'll put a link for down below in the show notes. She's dedicated to helping reduce the spread of HIV and ultimately eliminate AIDS. She also volunteers her time to act as the Navigator for the Northern Alabama part for ACA, Affordable Health Care Act, as well. She does this to support her specific cause and constituents, of course, but she also does it because she's a firm believer in all citizens is getting reasonable access to good and preventive health care. So she was completely motivated to help me when I called. She was very friendly, and we had a great chat, which was ultimately very sad and frustrating because we both knew right off the bat she couldn't do a thing for me. We started the conversation pretty much aware there was not much more than a chat between two people who believe in and want the same thing, and we are thusly stymied by one Robert J. Bentley. That's the former medical doctor who's now the current governor of the state of Alabama. As explained and for me more or less confirmed by Mary Elizabeth, Dr. Bentley has the sole capacity and the sole authority to bring forth the matter of expanding Medicaid. Quote, "It's solely in the governor's hands," end quote, she said. She also said there was a town hall meeting in my area not long ago done by Laura Hall, who's a state legislator, who confirmed to a big crowd there that it's all the governor. Nobody else could do anything even if they wanted to. His argument has been that the state cannot possibly afford it. And, I know what his arguments are made up of. See, for one thing, he says that even though the federal government is obligated to pay 100% of the care costs for the first 3 years, the admin costs are not covered. They all fall on the state. That's kind of not in the picture, obviously, but okay, I found that out. Also, after 3 years, the state picks up 10% of the care costs, which doesn't sound like a whole lot, but when you look at the bigger picture, that's probably a few million, maybe even billions at that point. It's a lot of money. And conservatives, beware. I'm about to shock you. I agree. Those are real problems, and they've got to be addressed. See, this does not have to be all one or the other, this conversation. Right? It doesn't have to be all, I ignore and refute your mathematical reality. I can't. Because you're right, math is math. Now, how that math is done is entirely based on what was spent in the first place. I know Alabama's budget woes are manifold, and there's some serious financial house cleaning that's got to go on, not just in Alabama, but all over the place. But I live in Alabama, so kind of where the focus is right now. My argument, however, is that the priorities of one Dr. Bentley and the rest of his coalition that runs the state government, they need to be reevaluated, right? See, care for your citizens, Dr. Bentley, should be as key for you as it was when you were caring for your patients. You would think somebody who's taken the Hippocratic Oath would get that. So instead of so much focus on what the wealthiest of your constituents are demanding of you, and really it's on the record, there's no arguing these points, the wealthiest of your constituents have driven a lot of your agenda. I just think you need to expend a little more effort on the folks in your state who really need you. I mean, can we just at least make a hand-waving gesture at that? Certainly there are systemic problems that need to be addressed where costs are concerned. Education of medical professionals is ridiculous in its expenses, and it impoverishes them at the beginnings of their careers. So they struggle to get those big dollar opportunities. And as much just because they feel like they deserve to live the good life, and that's not necessarily a bad thing. There's nothing wrong with wanting to live the good life. But as much as anything, they're just scrambling to make the money just to pay those damn debts off. And that's ridiculous. It's an education issue anyway, right? Mike Rowe, Dirty Jobs, his big thing is, we keep spending, you keep putting kids into horrific debt and their families in horrific debt to train them for jobs that don't even exist anymore. I mean, it's not exclusively that, but I get his point. And the bigger picture, Elizabeth Warren talks about this all the time, is that why are we impoverishing our students and so that their entire first part of their lives is nothing but trying to pay off a debt, when we should be trying to make it easy for them to get good jobs and contribute to society. And it's systemic. It's baseline, foundational, systemic issues that I don't care what side of the aisle or which animal is on your banner, we all agree on this point. These are just ridiculous situations, and it feeds into this, right? There's also the cost of the services and the products, and they need to be reined in. Guy who's currently coming at me on Facebook, he talks about interstate competition. I agree, Cameron. I agree. Interstate competition should be enhanced. There shouldn't be these laws that protect competition, and I don't think Blue Cross Blue Shield deserves the lockdown that it has on Alabama healthcare. In fact, we know that it doesn't. We know this is wrong, and yet we don't do anything about it. Well, so we got to do something about it. We need to enhance it. I've said all along, and this is the conservative talking point here. Sell health insurance like you sell car insurance. Let them all compete. You'll get the dollars down, right? You'll get the innovations. I agree. Now, I prefer personally a universal system. I think a single payer system is exactly the way to go, but we're not going to get there right away, and I accept that. In the meantime, let's use the tools that exist in our very system instead of protecting these little niches so that the cost can stay up. That's just stupid, and it's greedy. The math is about the greed. It's just we got to find where the greed really is. So I get where you're coming from. What I don't understand is why you're fighting. Why all of you who are fighting me can't see that while this is going on, folks like me are suffering and dying. I'm not dying, but there are people in my situation who are, right? And I'm in pain. I'm in a bad way. I've got a lot of things going on. I need to be under better care than I have, which is the point behind the quest, is to get health care. I mean, I'm not just trying to prove a point. I'm just using my experiences to show what's going on. But I really do actually need the health care. So why can't we accept a graduated approach? Why is it going to be all the baby out with the bathwater? It's one or nothing, right? Instead of just simply saying it's all bad and we can't do that at all, why can't people like me go ahead and use something like Medicaid to get some basic care and help while we're improving the overall system? Why can't we take the steps, right? Well, Medicaid's just going to blow up and beat you. You know what? That may be true, but they've said that about Social Security for decades. And yes, we're coming to a point where that's got to be fixed. But it went on for a long time, and people have benefited and continue to benefit from it. So while we are fixing the problem, can we not also do the humane thing and do the thing that was planned in the first place and get the people some health care while we're working on fixing health care? So anyway, after talking to Mary Elizabeth Marr, I followed what we both agreed was the next step. I called the governor's office. And it's in his hands. There's nobody else who can do anything. Calling my state representatives, calling anybody else, really not a point. So I called his office. I was naturally diverted to some voicemail. In this case, his constituent services specialist, a Terri Trotman. The number is 334-242-7100. In this case, anybody else out there wants to give Terri a call. I left a very nice yet firm message explaining my problem and my goals. I invited communication, and I made it clear that I fully intend to go and sit on someone's desk down their way in the near future if I don't otherwise receive some communication. I'm going to stage a sit on. I'll just plant my big old butt on somebody's important desk, and they'll have to have very large policemen come and drag me out, I guess, or something. But I'm going to do something to make a conversation happen. I'm hoping that some of you in the media will be happy to go with me, because I think it'll be fun. Because I have no shame and no fear. So this will be newsworthy, I'm sure. So like I said, I'm going to search for some media folks to go with me on that. My next step is to research a group also called, the Mary Elizabeth pointed me at, called Alabama Rise. I don't know anything about them other than she said that they're very active in trying to lift up the poorest and the bottom of Alabama. And, we have some light goals. So I'm going to check this group out. She actually felt strongly that maybe someone like me should become more active. Well, maybe I will. I'm also trying to figure out who I can reach in the Obama administration. See, I'm not ignoring him at all. I'd like to ask my president just what he expects me to do for healthcare until Alabama's grinchy heart finally grows. Because you see, every person that I've talked to, including Mary Elizabeth, right? I mean, she's a smart woman, done a lot. I respect her. But even she left with the whole universal hope belief that every person has said so far, that Alabama and other states will just get over it and see reason and thus make everything all better. I'm not so hopeful. that's going to happen without some serious pressure. I'm one guy, and I don't have the leverage of, look, multi-million dollars I can throw at something. All I got is me and you guys. So, what do you say?